Welcome to Liver Cirrhosis Nursing Mastery, a comprehensive video designed for AIIMS NORCET and other competitive exams. This video is brought to you by Mr. Nagesh Sir of ND Nursing Coaching. Let's begin with our first question. What is the primary pathological change in liver cirrhosis? Is it reversible fatty infiltration, fibrosis and regenerative nodules, hypertrophy of Kupffer cells, or acute inflammation of hepatocytes? The correct answer is fibrosis and regenerative nodules. Cirrhosis involves chronic inflammation leading to widespread fibrosis and the formation of regenerative nodules, which ultimately disrupt the normal liver structure. Next question. What is the most serious complication of esophageal varices? Is it dysphagia, hemorrhage, aspiration pneumonia, or chronic coughing? The most serious complication is hemorrhage. Esophageal varices are fragile vessels, and bleeding is a life-threatening complication that requires immediate emergency management. Which medication is used to decrease ammonia in hepatic encephalopathy? Is it furosemide, lactulose, spironolactone, or morphine? The answer is lactulose. Lactulose reduces ammonia by acidifying the gut, converting ammonia to ammonium, which is then excreted in stool. Asterixis is a characteristic finding in which of the following conditions? Portal hypertension, hepatic encephalopathy, ascites, or jaundice. Asterixis, or flapping tremor, is a neurological sign indicating the buildup of toxic metabolites, specifically ammonia, in the brain. Therefore, the answer is hepatic encephalopathy. Which diuretic is preferred for ascites? Your options are mannitol, spironolactone, acetazolamide, or hydrochlorothiazide. The preferred diuretic is spironolactone. It is a potassium-sparing diuretic, often chosen to treat ascites and cirrhosis, because it counteracts aldosterone excess. Phaedra hepaticus refers to yellow skin, fruity breath odor, musty, sweet breath odor, or dark-colored urine. Phaedra hepaticus is a characteristic musty, sweet breath odor caused by metabolic byproducts, specifically mercaptans, that the liver cannot process. Which lab value is expected in cirrhosis? High albumin, low PT-INR, high ALT and AST, or low ammonia. The expected lab finding is high ALT and AST. These liver enzymes are elevated due to ongoing damage to liver cells. Conversely, albumin and clotting factors typically decrease. Paracentesis is a procedure used to drain acidic fluid, remove excess liver tissue, measure gallbladder pressure, or biopsy the spleen. The correct use for paracentesis is to drain acidic fluid. This involves needle aspiration of fluid from the peritoneal cavity to relieve pressure and for diagnostic sampling. What is the nursing priority immediately following a paracentesis? Check blood sugar, monitor for hypotension, increase protein intake, or ambulate immediately? The nursing priority is to monitor for hypotension. Rapid removal of acidic fluid can cause significant intravascular volume depletion, risking shock and hypotension. Why does edema occur in cirrhosis? Is it due to low plasma oncotic pressure, increased protein production, heart failure, or kidney failure? Edema in cirrhosis is primarily due to low plasma oncotic pressure, resulting from the liver's inability to synthesize sufficient albumin. What is a nursing priority for managing pruritus in cirrhosis patients? Should you apply hot water, keep skin clean and dry, and use cool baths, apply perfumed lotions, or avoid all bathing? The priority for pruritus is to keep the skin clean and dry and use cool baths. This minimizes irritation and helps relieve the itching caused by elevated bile salts. What is the major risk associated with the use of a Sengstaken-Blakemore tube? Is ite infection, airway obstruction/aspiration, increased appetite, or hypertension? The critical risk of a Sengstaken-Blakemore tube, used for esophageal bleeding, is airway obstruction and aspiration, requiring close monitoring. Vitamin K is given to cirrhosis patients for what purpose? To treat infection, improve clotting factors, reduce jaundice, or lower ammonia. Vitamin K is given to improve clotting factors. Liver dysfunction reduces the synthesis of clotting factors that require vitamin K, increasing the risk of bleeding. Which diet is typically prescribed for a patient with cirrhosis? High sodium, low sodium, and moderate protein, high fat, or unlimited. A low sodium and moderate protein diet is often prescribed. Sodium restriction helps manage ascites, while protein is restricted only in cases of severe encephalopathy. Finally, what is a spider angioma? Is it a bacterial infection, small vascular lesions on the chest, a liver cyst, or a bruise? The correct answer is small vascular lesions on the chest. Spider angiomas are small, dilated blood vessels with a central red dot and radiating extensions, common in cirrhosis. Next question. The I in TIPS stands for intrahepatic, interventional, intravenous, or iliac. The I in TIPS, which stands for transjugular intrahepatic portosystemic shunt, is intrahepatic. This procedure helps reduce portal hypertension. Which is the best assessment for liver size? Is it percussion, ultrasound palpation alone, or X-ray? Ultrasound is the best assessment for liver size. It provides a non-invasive and accurate visualization of the liver parenchyma and dimensions. Jaundice in cirrhosis is caused by bile duct obstruction, inability to conjugate bilirubin, hemolysis only, or high iron intake. Jaundice in cirrhosis is mainly caused by the inability of the damaged liver to conjugate bilirubin, leading to its accumulation in the blood. What is a key risk factor for cirrhosis? Low blood pressure, alcoholism, high-fiber diet, or vitamin C intake. Alcoholism is a key risk factor for cirrhosis, as chronic alcohol abuse directly damages liver cells. Why does gynecomastia occur in male patients? Is it because the liver can't metabolize estrogen, high testosterone, too much water, or a low-fat diet? Gynecomastia occurs because the cirrhotic liver can no longer effectively metabolize and inactivate estrogen, leading to hormonal imbalance. How is ascites managed in severe cases? No treatment, paracentesis and albumin replacement, high fluid diet, or ice packs. For severe ascites, management includes paracentesis to remove fluid and albumin replacement to prevent large fluid shifts and hypotension. Why is GI bleeding a medical emergency? Blood is acidic. Blood contains protein that increases ammonia, it causes pain, or it lowers sugar. GI bleeding is an emergency because the digestion of blood protein significantly increases ammonia levels, which can rapidly worsen hepatic encephalopathy.